So I'm Florence Dedey of the Breast Unit Department of Surgery, Korle Bu Teaching Hospital. And I'd like to take you through how to do a self-breast examination. So we are in the month of October, and we like to remind everybody of the need to do self-breast examinations. So for every woman starting from the age of 20 years, we advocate that you examine your breast yourself once every month. For women who are still having their menses, do so about a week after your menses have ended. For women who have stopped having their menses, you can do that anytime. Choose a time in the month that you always remember. But the important thing is to do it once a month. And once you do it once a month, after a few months, you become very familiar with what your normal breast looks like and feels like. At times when people are starting, they feel like they are not sure what they are feeling or what they are supposed to be feeling. But just keep at it. Once you keep doing it, you become familiar with the normal. And when something changes along the line, you would be able to pick it up. So the importance of the self-breast examination is for you to be able to pick up changes in your breast very early before they become very gross. So you don't want to wait for a swelling to become as big as your fist when you can pick it up when it's as tiny as just the tip of your finger. When you see any change, you should report to a hospital. So don't notice a change and also decide that this is nothing. The importance of doing the examination is to pick up changes and to seek the necessary help. So what you do is you undress to the level of your waist. So as this mannequin is, you expose yourself. You stand in front of a mirror so that you can see the breast. And then the first thing you do is to look at the breast in the mirror. You are looking for any changes. So are there changes in the skin? Does it look like there's a swelling somewhere? Does it look like one breast is smaller or bigger than the other? Is the nipple pointing in a different direction, or is the nipple being drawn in? If you notice any change at all, especially something, the breasts are two, so they should be the same. So if one side looks different from the other, then something has changed and you need to make sure that it's nothing to worry about. So look at the breast in the mirror, and then the next thing is to lift up your hands all the way up and still look. As you lift up your hands, the breast is lifted up a bit. If it doesn't go up all the way, you can actually use your hand to lift it up so that you can see the underside of it as well. So you basically want to look at the entire breast, both sides, and see if there are any changes. Once you've done that, then the next thing to do is to lie down. So you can lie down that way. And then if you're examining the right breast, you put the right hand under the head. So this mannequin doesn't have a hand in the head. But then you put your right hand under your head, and then you use the opposite hand, so this hand, to examine this breast. And what you want to do is to feel the entire breast. So there are various ways in which you can do it. You can decide to start from the middle, and you are using this part of your fingers. So you are not holding the breast like that. If you hold the breast like that, it feels like there's a lump. And you hear people talking about the normal breast lump. There's no normal breast lump. If you do the examination in the right way, you wouldn't feel a lump if there's nothing there. So you use the flat part of your fingers, and then you press between your fingers and your chest. So you can start from where the nipple is and go all the way around. You can go around like in circles, so all the way till you've examined the entire breast. Go all the way up almost to your collarbone, go down to where the breast ends here, the middle parts, and then at the side here. You could also decide to start from the middle, go up, come down, up, down, or you start from here and go this way. The most important thing is you've examined the entire breast. So you do that for this side, and then once you are done, you squeeze on the nipple. So you try and squeeze on the nipple this way and that way and see if there's any discharge from there. And then you change hands. So now you use your right hand to examine this one. You put your left hand under your head here, and you do the same examination again. Using the flat part of your fingers, you press, and then you go all the way around and see if you can feel anything. So if there's a lump in there, you feel like a little swelling, something like a little pebble or a little stone. It may not be so hard, it could be soft, but you feel like there's some swelling over there. And once you keep doing it, like I said, every month, if at a point it wasn't there, and then along the way it develops, you will notice it because something has changed. So you finish with this one, and then you also press on the nipple the same way, this way and that way, to see if there's any discharge. Once you are done with both of that, then you can sit up again, and then you can check your armpits. So we know that when there are problems in the breast, specifically when there's cancer in the breast, it can go into the armpits. So once you finish examining this breast, you use the left hand again, and you also you feel around the armpits to see if you can feel anything. Change your hands and do the same thing at this side. So basically, that is what the breast self-examination is all about. Some people find that they can feel changes better when their skin is wet. So instead of lying down in bed to do it, they would rather do it in the shower. So obviously you cannot lie down when you are taking a bath or you are in the shower. So then you would stand and still put your hand behind your head and use the other hand, the opposite hand, to do the right, and then change and do the same thing. So that is with some soap and water on your body. And some people find that it's easier to feel changes that way. So if you find that that is easier, then you can do it. If you want to also do it lying down in bed, you can do it that way. But the message is to do it every month so that you know what your normal is, and what you are looking out for are changes, any change at all in the breast. So the fact that there's a change there does not mean it is cancer. There are so many changes that are not cancerous. So all the changes that cancer can cause, other diseases of the breast can cause that as well. That's why I said when you notice a change, go to the hospital, let somebody look at it, and they can examine you, do the necessary tests, and decide whether this is something you need to look at further or have any further treatment for. If you notice that one breast is bigger than the other, it could be normal. And for most women, they know that one breast has always been bigger than the other. That is not a problem if you know that is so. But if that wasn't so, or if that wasn't your normal, and one day you examine yourself and you realize one breast is bigger or one breast is smaller, please seek some medical attention. You may also notice a change in the way the nipple is pointing. So usually the nipple will point downwards and outwards like that. If suddenly you notice that the nipple is now pointing this way, or it's pointing up, or it's gone inside. And with the one going inside, for some people that is actually normal. Their breasts, their nipples naturally are inside. But again, they know that to be their normal. So if you notice that and it's always been like that, you don't worry. But if it's a new change, then you have to seek medical attention for it. If you notice any swelling, either from looking at it or from feeling it, there's a mass, there's a swelling, you need to go and have it checked out. If there are any changes on the skin, there's a rash either, and the skin could include the skin on the nipple and in the areola area as well. So if there's a rash, if there's a sore, if the skin looks like an orange peel, any change at all. So once there's a deviation or a shift from what is normal, you should go and have it checked out. Don't sit at home and decide for yourself, this is nothing. Let somebody look at it, and indeed, if it's nothing, then that's all well and good. All right, so as part of the Pink October celebrations, or the things to mark the Pink October, the University of Ghana Medical Students Association, in partnership with Surgical Ward 2, that's the breast unit, is organizing a blood donation for the breast cancer patients. So this will take place on Friday, 17th October from 9 a.m. to 4 p.m. at the Basic Sciences. So this is an invitation for everybody to pass by there and donate blood to save a life. Thank you.